It's time for Access the Experts from the University of Nebraska at Omaha with your host, Brandon Axamit.
Hello and welcome to another edition of Access the Experts on News Channel Nebraska, where every Tuesday and Thursday, University of Nebraska at Omaha faculty members answer today's questions facing our state. Now today we have the pleasure of hearing from Dr. Kate Cooper, who is an assistant professor at UNO's School of Interdisciplinary Informatics. So Dr. Cooper, today's question is, how is a virus or variant named?
Thanks for that question, Brandon. I would be happy to talk to you today about how viruses and variants get their name. Let's start by recognizing that there's a difference between an infectious disease and the pathogen that causes that disease. In the case of our current pandemic, COVID-19 is the name of the actual disease, and SARS-CoV-2 is the virus that causes it. Before 2015, there was no real formal system in place globally. There were guidelines, but no formalized system in place to actually name a new human disease. Before then, some viruses were named in reference to the location in which they were discovered. So for example, the Ebola virus was first identified in the 1970s in a village near the Ebola River in Africa. Hantavirus, which is common in rodents, was also first identified in the 1970s in the near the Hantan River in South Korea. And we have seen throughout history that when we actually associate a virus name with a geographic location, a person, an occupation, or an animal like swine flu, there are negative impacts on things such as travel and on tourism, and actually directly on people as well. So in 2015, the World Health Organization created a new framework for naming viruses to be descriptive of the virus, while reducing that potential for negative impact and negative associations with people, animals, places. Viruses are named to help scientists develop diagnostic tests, develop vaccines and treatments. We see this with the current pandemic. We have scientists all over the world that are currently trying to help end the pandemic by studying these things. But to do that, we have to have a common nomenclature that clearly describes what we're actually supposed to be studying. So when we describe a variant of a virus, we are actually describing a set of mutations that are being observed in a very, very small subset of the population that doesn't necessarily fundamentally change the virus itself, but it does have a different measurable genetic signature and possibly also differences in transmissibility and severity and that sort of thing. Naming these different variants has risen to the forefront during the COVID-19 pandemic because we want to be able to clearly articulate to the public and to the scientific community what's actually happening with the virus. So the new naming system using Greek letters that we've seen come up for coronavirus was developed by the World Health Organization. They have a working group, and it was done specifically to enhance transparency to the general public, for easy communication between the scientific community, and to reduce that geographic stigma that we talked about before. So thanks for the timely and relevant question. And if you're interested in knowing more, please visit www.unomaha.edu.
Thank you, Dr. Cooper, for sharing your expertise on the topic. Now for our viewers at home, we want you to interact with UNO's experts. So if you have a question you want answered, submit it at newschannelnebraska.com.
Access the Experts, presented by the University of Nebraska at Omaha. If you have questions, submit them on our website. Then join us every Tuesday and Thursdays at 6:46 a.m. and p.m. while we answer your questions.